Ambulance brings a 28-year-old man to the emergency department after he developed an altered mental state following blunt trauma to the head. The patient was competing at a local mixed martial arts competition where he was struck in the head and lost consciousness. A few minutes later, upon regaining consciousness, he experienced progressive decline in mental status. Medical history is non-contributory. Upon his arrival at the hospital, temperature is 37, blood pressure 145/89, pulse 66 and respiration is 14 and oxygen saturation 99% on room air. He is alert now. A non-contrast CT scan is performed and the result is provided in the image below. Which of the following structure is most likely affected in this patient? The options are bridging veins, middle meningeal artery, subarachnoid space, suprasellar cistern, and ventricular system. All right, so this is a patient who had an accident. Okay, he struck his head in a martial arts competition. Fine. So this is a traumatic head injury patient again. He had altered mental status. He regained his consciousness and then he kind of declined again. So what they're describing over here is what we call lucid period in this particular patient, and it's very common, especially with what he has. So let's see what they have, right? Everything else is kind of okay. He is a little bit bradycardic and hypertensive. This patient also had, well, they did a non-contrast CT. That is the first thing we do, and it showed this photo right over here. It is a lens-shaped hemorrhage, epidural hematoma. Great. So classic presentation, right? Lucid period, this lens-shaped hematoma or the hemorrhage is epidural hematoma. Okay, in epidural hematoma, as we just talked about when we were talking about the foramen spinosum, it's because of the rupture of middle meningeal artery. Okay, now it can be due to trauma, it can be due to coagulopathy, or maybe a bleeding diathesis. Maybe somebody just has a bleeding disorder, right? It is an arterial bleed, and as we mentioned before, middle meningeal artery goes into the skull through foramen spinosum. Okay, what are the signs and symptoms if somebody has epidural hematoma? So first, as they mentioned in the question itself, patients are having lucid interval, where you think that patient is going to be fine after they lose consciousness initially. When they wake up, you'll be like, okay, maybe the patient is fine, but no, within a couple hours, they are going to get back to like a very kind of a drowsy state where you won't be able to even, awake them, or like they will not be alert, they will not be oriented, and they will not be even following any commands or anything like that. Patient might be having a history of head trauma, like in this patient. Yes, they will be having increased intracranial pressure. So when you do a physical exam, you might see papilledema. They can also get seizures if it kind of prolongs, and if it involves some kind of cortical structure, then they can also have some focal neurological deficits. Okay, when you do the physical examination. Also, you will have to do the Glasgow Coma scale. If it's low, that I think the lowest, I think it's from 6 to 8, something like that. I guess it's 6. If it's below 6, then you will need to intubate them because there is obtundation. Patient will not be able to protect their airway because they are kind of not following their CNS system. Their CNS system is not working because it has having bleeding, right? The maximum is 15, if I remember it correctly. They will be having Cushing reflex, which is bradycardia with hypertension, right? And if it's too much of bleeding, then it can also cause herniation, whether it's midline, whether it's down ankle herniation, it can go either ways, okay? So diagnosis, as they did, we have to do non-contrast CT scan first to rule out a hemorrhage. If there is a hemorrhage, you will see what they have over here, which is a hyperdense lesion. If it is a lens shape like this, why is it a lens shape? Because epidural doesn't cross the suture line. It's above the dura mater, and dura is attached to the periosteum, right? So if it's epidural, they will not be crossing the suture lines, and that's what gives the lens shape appearance. Okay. For differentials, you can get the coagulation panel done. Treatment would be depending on how much the bleed is. If there is herniation, if patient is intubated, something like that, they need neurosurgical consult. Okay. If it's a small bleed, then you can do a conservative management. But otherwise, for increased intracranial pressure, you can give them mannitol, which is a diuretic. You can also position them in like 30 degrees up front. And if they are intubated, like as I mentioned before, if they have a low Glasgow coma scale, then you may want to like hyperventilate them a little bit, because hyperventilation is going to cause cerebral vasoconstriction. Okay, so that's also going to bring their intracranial pressure down. These are some of the treatment measures that you can do for patient with epidural hematoma. Okay. So let's go over the other options. First is bridging veins. Bridging veins are involved in subdural hematoma, and subdural, as the name implies, is below the dura mater, and it's a venous bleed, as the name implies. It's a venous bleed. Also, it's going to cross the suture lines, because of course there is no suture below the dura mater, right? It kind of flows along, so you're going to get a crescent shaped concave kind of a bleeding appearance, a hyperdense lesion kind of a thing. Subdural is basically more common in infants and in elderly. Okay, trauma can cause it, yes, coagulopathy, same causes, yes, but it can be acute if it's too much, and it can be chronic. That means, especially with elderly people, they might be just bleeding and nobody knows, you know, like they might not be having any symptoms like headaches or any kind of other symptoms. So diagnosis is going to be the same. If they present, you're going to get a non-contrast CT. You're going to see this hypertense lesions, not like what they have over here, but if you Google subdural hematoma, you will see like a nicely crescent-shaped hemorrhage. Also, treatment is going to be the same. If it's larger bleed, then you might need to do a neurosurgical consult and open the skull up to evacuate the bleeding. Okay, next is the subarachnoid space. When you're bleeding in subarachnoid space, we call it subarachnoid hemorrhage. Okay, aneurysms, more common. Okay, whenever you have a question scenario, or somebody is describing your scenario where a patient is having an aneurysm in the brain, what are you worried about? You're worried about subarachnoid hemorrhage. Okay, and AV malformations. They're another ones. Also, some of the AV malformations, you can see some hereditary conditions. So those are certain conditions that you can associate with subarachnoid hemorrhage. Okay. Their presentation is going to be just headache, nothing much. Yes, increased intracranial pressure, maybe papilledema, but they are going to describe as their worst headache of their life. Diagnosis is going to be with the CT scan. So when you do a lumbar puncture, you document it as xanthochromia, okay, which is kind of pinkish CSF that is bleeding within the CSF. Okay. Treatment for subarachnoid hemorrhage is basically to control what is causing it. So if it's an aneurysm, you want to repair it. If it's just a trauma, something like that, you want to maintain the blood pressure, you want to do the anticonvulsants. That kind of goes for every kind of a bleed, because you know, it's in the brain. So anytime they can get seizures, they can get herniations. So you want to control blood pressure, give them anticonvulsants, and surgery, of course, is the last resort to either repair or even evacuate any kind of bleed. Okay. Suprasellar cistern. So cisterns are basically the large dilations in the subarachnoid space itself. So when you have a subarachnoid hemorrhage, those spaces are going to get filled with blood. Okay, and when the blood accumulates in there, it's going to cause a massive kind of a bleed, and it's an emergent kind of a condition where you have to where you will have to do a surgery. Okay. Ventricular system, when you're bleeding within the ventricles, it's more common in premature infants, and we call it intraventricular hemorrhage. Sometimes even intraparenchymal bleeds can also extend into the ventricular system, and it's also life-threatening. Well, ventricular system can also be affected by other kind of bleeds like epidural and subdural if they are too much, because of the compression, you know, the mass effect.
Thanks for watching. Please give a thumbs up and subscribe for more.